I've had patients that have had open myomectomies, and then I'll do their second myomectomy robotically or their hysterectomy, and so they have a direct comparison. They know what their recovery was like before and what their recovery is now, and it's very dramatic. The ones who never had to go through open surgery and are just getting a minimally invasive surgery, they're leaving the hospital the same day.
They're usually home within about 4 to 5 hours after the surgery is complete. Typically in 2 to 3 days, they're getting back to their routine activities, and within a week, they're back to work. If you look at an open surgical procedure, patients are in the hospital for 2 to 3 days. So when a patient undergoes a robotic myomectomy, they're back driving, doing some routine activities, when if a patient had an open case, they'd still be sitting in the hospital.
With these benign conditions, there's any number of reasons why a woman can put off surgery. You know, again, she's the center of the family, it's not a good time. No woman looks at their calendar and says, you know, this would be 6 weeks that I would love to be in bed recovering from a surgery. No one has that time. And so, I mean, really the advantage of the robotic surgery is these women have horrible conditions and they need operated on. But with the Da Vinci system, they're getting it done and then they're back to their lives.
The majority of patients are sitting up and they don't even look like they had surgery. And they feel so well. In fact, I've had to caution when I counsel my patient before surgery, preoperative counseling, I often tell them, I said, now I'm going to do this surgery and you know, your recuperation is so phenomenal that you're going to want to do things. And I said, you know, you can't go out and do all, there are limitations.
It always goes back to the patient. So we can get caught up in the technology, we can get caught up in the advancements, we can get caught up in all those things, but really at the end of the day, it's just about, is it better for the patient or is it not? And it obviously is, whether you're talking about blood loss or complication rate or recovery time, pain involved, all those things are improved.
The 3 top benefits for patients undergoing robotic surgery, Da Vinci surgery, are going to be 1, return of work and return to their daily activities in a much shorter time period compared to open surgery. 2 is the incisions that they will have with robotic surgery are much more cosmetically appealing. And 3, morbidities or complications of the surgery are going to be less with robotic surgery compared to open surgery.
Not only did the hospitalization decrease, their recuperation decreased, and also there were less pain. And I just recently analyzed my first 120 patients, and the end variables that we measure was what type of pain medication they required and what were they using. About 10% of our patients didn't require any medication at all. No Tylenol, no Motrin, no narcotics. About 30% of the patients require non-narcotic pain medications such as Tylenol and Motrin. And the women who require narcotics, they were only taking it for maybe at most a week.
We very rarely have to make a big incision. Our open rates, or the rate at which we do abdominal hysterectomies, has fallen down to about 2 to 3%. Prior to robotics, ours was about 20%. Nationally, it's 65%. So there's room for a huge improvement over the country and a lot of benefit to women in healthcare with robotics. Other parameters, estimated blood loss, length of stay in the hospital drops to about 1 day, if not less. Would you use it on your own family? Absolutely. Small scars are obviously better. You know, we tend to think about it from a pain and recovery and infection rate, blood loss. As physicians, sometimes patients think, aesthetics. I just don't want that big incision. And that's a legitimate concern.
Cosmetics is hugely important, and I mean, I think it should be important. I mean, again, just because you have a certain GYN condition does not mean you have to have a disfiguring scar. There's a better way to do surgery, and we have it now, and we're here.
For an open myomectomy procedure, they're going to have an incision of approximately 6 to 8 inches. For robotic surgery, they're going to have 5 small incisions that are approximately 1 centimeter or so, which is the size of a fingertip. In terms of recovery, when you have a large open abdominal incision, it's just not the skin incision, it's the dissection of the muscles of the anterior abdominal wall that take a significant amount of time to heal.
At the end of the day, the woman, whatever problem she has, bleeding, fibroid, endometriosis, during that time when she is affected, she's in a lot of pain. And she'll say she doesn't care. But when everything's done, 2-3 years later, all you have to remind yourself is that scar, and you care now. Because all the pain, everything you went through, that's now gone. But you live with that scar the rest of your life. So they start out, red, and then they'll disappear into white lines. And what's nice is a woman can wear a bikini, she can wear, kind of belly-bearing things, and it's not immediately obvious that she had surgery. What I want them to do is I want them to ask the question of, thank you so much for your opinion. I appreciate all the information you're giving me. Is there any other way to do my surgery? And I think that question alone can get a whole host of answers. And usually, hopefully the answer is, I've heard of robotic surgery, I've seen it done, I cannot do it, but I know this surgeon in town who can.
Women are very loyal to their OB-Gyns, and rightly so. They form that bond with their gynecologist, and they don't want to give up their doctor, even if it means having a different type of surgery than they might think or might be told is better. So, a lot of it at this point, I think, is just getting enough surgeons trained, so everybody has that option. And then, I like to say we're one good Oprah Winfrey show away from all of America and all women understanding what is available.
I think it's a lack of the woman not knowing her options. Also, a woman will put herself last, whatever her doctor who says to her. She'll research her husband's prostate operation, but if the doctor that she trusts says, you need a hysterectomy, I'm going to do it open, you're going to spend 4 days in the hospital, you'll do it great, she'll say, fine, great. So it's a lack of education and not knowing, really awareness, and also just trusting the doctors that they've had. We need them to ask, is there a better way? Is there something else that can be done?
So being a reproductive endocrinologist, a large percentage of the patients that I do fibroid surgery on are interested in conception. And a large percentage of patients that we see are over the age of 35. So age is a critical factor. So when I talk to patients about a traditional open approach versus a robotic approach or a minimally invasive approach, the added benefit of doing the minimally invasive approach is it does not delay their fertility treatments very much. Patients can have the robotic surgery done and the following month start to begin their fertility treatments.
Our economy right now, this recovery is huge. It's coming to the point where if you offer a woman open surgery and she has to be out from work for 6 weeks in this economy, she just won't do it, and she'll just put up with it. And I've had women who have gone to surgeons, getting offered open surgery, and when they come to me, they say, I need it robotically because I can't afford to be out from work.
Most patients who have fibroids have been suffering for typically a fair amount of time. And a lot of them are scared to undergo a major open abdominal surgery, and they delay and they delay. And I find when I talk to patients and say, look, there is a minimally invasive approach to treating these fibroids, that they are extremely happy that now there's an alternative for them, and they're much more apt to have the surgery.
One of the biggest differences are the myomectomies, the fertility-sparing surgeries. These are surgeries where they require a huge amount of suturing. And really the repair on the uterus is so crucial because, again, we're trying to repair a uterus so that it'll be functional in the future and be able to hold a pregnancy. And so the suturing ability of the Da Vinci robotic system has made me able to do these surgeries in a minimally invasive manner.
And I think the big difference between laparoscopic and robotic surgery is because it is the robotic surgery, it is designed in such a way that the instrumentations are inserted and there's a focal pivotal point, that the movements are very precise and minimal, that it does not torque the body. So there's less pain associated with it.
Also, cancer surgery has really been changed by the Da Vinci. I mean, routine staging of uterine cancer is now usually done on the Da Vinci, and it can be done well. Also, early stage ovarian cancers, early stage cervical cancers, also even prolapse surgery for women, for the sacrocolpal plexus. These can be done on the Da Vinci. These were all operations that were very hard to do in a minimally invasive fashion. And again, what we're looking for is the best result for the patient, but also if you can give the surgeon more comfort and more dexterity in doing it, I guarantee you'll have a better outcome.
I've been able to offer patients a minimally invasive approach to uterine fibroid surgery, myomectomies, and tubal ligation reversals, which in the past I had to offer them open surgical procedures. The reason is that with Da Vinci, I'm now immersed in the surgical field, and I'm able to appreciate depth perception. In addition, with the endo-wristed instruments, I can mimic my surgical motions that I did in open cases, now in a laparoscopic or minimally invasive format.
If you think about the laparoscopic versus the Da Vinci, it's like trying to put a screw in. The laparoscopic is the conventional screwdriver that you're using a tool and you're basically screwing in, as opposed to the Da Vinci is this automated, the Black & Decker Speedo that you can just basically drill it, and it's much quicker and faster and precise.
I'm a Da Vinci surgeon because I believe that women deserve the best surgery possible for their GYN condition. And the majority of those surgeries can be done on the Da Vinci robot. And it's changing the lives of women, and it's improving their outcomes.
I'm a Da Vinci surgeon because I'm fortunate enough to live in an era right now that the surgical field is evolving. This is a cutting edge that gives my patients the best care, particularly cancer, where I'm in the field of cancer, faster recuperation. They can get their treatments. If they need additional treatments much quicker, they can get their life back a lot quicker.
I'm a Da Vinci surgeon because I can offer patients a minimally invasive approach when in the past I had to offer them an open abdominal approach. The benefits to patients are going to be shorter recovery, improved cosmesis, and less morbidity or complications with robotic surgery.
Now, I'm a Da Vinci surgeon because it's obvious to me that this is an improvement, a paradigm shift, if you will, a leap forward in our ability to take care of our patients. And there's no doubt in my mind that I get better results using Da Vinci when I do hysterectomies or myomectomies or bladder suspensions. It really comes down to the bottom line. If I was going to have somebody in my own family operated on, would I want that surgeon to be trained in robotics? Yeah, I would. So you do for your patients what you do for your own family.